Well, when it comes to cancer, cancer is very complex. And we know that much of cancer, we used to think it was strictly genetic. We now know that there's a huge environmental component and that we have the ability to upregulate or downregulate genetic potential for expression by how we live our life. So for instance, I'm BRCA positive, I have the gene for breast cancer. Just because I have the gene for breast cancer doesn't mean I should go have a prophylactic breast removal like Angelina, but it doesn't mean I should be eating soy or exposing myself to chemical xenoestrogens in the environment. I need to watch my plastic and BPA exposure. There are great things I can do, even though we all have genetic predispositions that aren't so good. We can keep them in the box through living a healthy, detox lifestyle that resonates with our body type. Along the animal vein, we can totally do common sense things. All dogs and cats have potential genetic predispositions lurking in their DNA. We can downregulate a cavalier from having a heart murmur by feeding a species-appropriate diet where the protein isn't offset by cheap, unnecessary carbohydrates. We can do things like putting cavaliers on ubiquinol to upregulate heart function. We can do things like minimizing parvo, distemper, adenovirus, parainfluenza, lepto, crotaline, bordetella, rabies. We don't need to be vaccinating these dogs every year till they die. We can reduce how many topical pesticides we put on indoor house cats month after month for no reason. We can do common sense medicine to dramatically decrease the environmental aspect of cancer for dogs and cats while nutrigenomically unlocking nutritional potential through a species appropriate diet. Easy, common sense, not actually, if anything, going to save money. But the frustration is sometimes the DNA is still there for cancer to occur, and sometimes we don't figure out these things until halfway through a dog's life when it's already in the works, when abnormal cellular replication is already in the works. So what do you do at that point? Well, you have three options. You can panic, and I'm going to encourage you to not panic, but innately you do panic. You will see an oncologist or you go to your local general practitioner, but above all, usually in a state of panic, you're unable to think straight, and you sometimes allow other people to make decisions for you without thoroughly researching your own decisions and being an advocate for what you know to be true. So this is what needs to happen. You get a diagnosis, you need to do all the research online. Don't buy 727 supplements. You need to figure out what type of cancer your pet has and why. There are some genetic predispositions for certain types of cancer that it's important to understand. The website vsso.org will give you the veterinary surgical outcome statistics as well as the chemotherapeutic outcomes statistics. I refer all my clients there because sometimes I'm the third or fourth opinion, and my clients will come in saying, listen, I was told I have to do chemo, I have to do radiation chemo. You go on this website and you see that there's an 18% chance of recovery with chemo and maybe a 12% with chemo. Statistically speaking, prayer would be honestly more effective than those two modalities for that particular type of cancer. That's when you need to begin thinking, and if you already know in your heart you're not going to do a traditional route, you need to investigate all of the options you have within the holistic realm, and they are massive. No one holistic veterinarian or integrated veterinarian offers all of those options. So you may need to do hyperbaric or ozone, or you may need to do blood therapy, you may need to do UV therapy, you may need to do other types of therapy that you may end up driving out of state. But depending on where your commitment is and depending on how committed you are to finding alternative outcomes that statistically could be more effective than what traditional or conventional veterinarians offer you, you are willing to do probably almost anything. And so what I will encourage you to do is find the options that resonate with you on an intellectual level, but then you're probably going to have to drive to find them, but really pack up and drive to find them.
Thank you.
All right. Was that good?
That was awesome.
Okay.
I appreciate it.
No problem.